Let's face it, no one wants to think about a colonoscopy, but colon cancer is deadly and symptoms are hard to detect. Colonoscopies are the best tool doctors have to catch it early. Here now with more is Michael Sickler of the colon cancer screening program at MedStar Health. Also, we've got registered nurse Tiombe Mitchell. Welcome you two.
Thank you for having us.
So I know that last year MedStar Health performed the most free colonoscopies in the entire state. How is that? How is that happening?
We're funded through the Maryland Health Department, and we're actually funded also through the Cigarette Restitution Fund. So we have grant money that we supply to patients so they can get free colonoscopies through the state.
And tell us about the importance of early detection. Why is this such an important issue?
We always like to think that the greatest risk that you have is inaction. So by doing a preventative screening, you're making sure that you don't get cancer. If you do them on a regular, timely basis, it's really a helpful preventative measure to make sure you don't get cancer.
And specifically with colon cancer, if you have early detection, the cancer can be removed. And you are it's curable.
It's curable. So you just really need to be proactive. But the problem, and I think a lot of our viewers will agree with me, is that you hear colonoscopy and you're like, So, but you have to do it. So walk us through the process, because I don't really think it's as scary once we hear it from a medical professional who knows that it's not.
No, it is. The largest barrier most people have is the prep. This is a procedure, it's outpatient. You are lightly sedated, so you don't feel anything during the procedure. A small scope is inserted, and the physician can see your entire colon from start to finish and can remove at that time any polyps or abnormalities that they see during the procedure. It lasts about 2 hours. It's a one-day procedure.
The actual procedure is only about 30 minutes, though.
Right.
And then how often do you have to get it done?
It depends
on the findings. So if you have no polyps, it is a 10-year recall.
Okay.
If you're not considered high risk, which means you don't have family history, you don't have a personal history. If you find a polyp that is considered high risk, it could be between 3 to 5 years.
And we talked about the free colonoscopies. I want to revisit that as well.
Sure.
Just because, I mean, it really is amazing. How do we qualify? If someone's watching and they're wondering, how do they go about it?
Please call if you have any questions, but you have to be of no insurance, or if you have insurance and you have out-of-pocket expenses, we will cover the out-of-pocket expenses. We even cover the bowel prep. So basically, we're making sure that we navigate you from start to finish with your appointments and then the colonoscopy itself, and then we'll also give you the results to make sure everything's okay.
And is this at all of the MedStar locations?
We service all 4 MedStar MedStar hospitals in Baltimore, MedStar Franklin Square, MedStar Harbor Hospital, MedStar Union Memorial, and MedStar Good Samaritan.
So all of them.
Yeah, so it's easy locations.
It is easy location. And I know that you also make it easy if there's a language barrier, right? Are there translators? There are, right?
Yes, we have a Spanish translation on staff. We also have access to language lines, so if you speak another language, we can help you as well.
Oh, great. Okay, so people are watching again, and they were like, okay, fine, I'm going to do it. I know I need to. What are the next steps? What do they do?
Please call us. We'll go over your eligibility. You can also go online and sign up for a request for a contact online on our website. We'll go through everything with you, and if you qualify, we will schedule your first appointment. If you are eligible for another county, because this program is offered throughout the state of Maryland, we'll refer you to someone who can help you with your screening.
Okay, great. And then also, if you just want to get a colonoscopy and you don't qualify for this program, it's what, talking to your doctor
primary
first?
Care, yes. Always start with your primary care physician. They can tell you if you're of age, if it's time.
Yes.
Even if you're unsure, just start the conversation and they'll direct you.
And we can help you get doctors too. So if you just call us, we'll be more than willing to help you with your own insurance, get physicians.
All right. Again, you can visit medstarhealth.org or call 410-350-8216 for more information. And remember to tune in today to MedStar's Colorectal House Calls from 4:30 to 6:30 p.m. right here on WMAR. We'll be right back with more Midday Maryland right after this. Stay tuned.